Okay, so the first one, we've got a lot of people asking questions about pandas, and that's a pretty common thing around here for us to have questions about pandas. People want to know, and this viewer in particular wants to know, how can I get my child tested for pandas? And if it's positive, how will it be treated?
Okay, well, what PANDAS stands for is Pediatric Autoimmune Neuropsychiatric Disorders Associated with Strep. And by strep, that means the streptococcal bacteria. So there was a lot of excitement and interest generated about pandas because, at least superficially, some of the symptoms of pandas look a little bit similar to some of the behavioral symptoms that a child with autism can show, but it's not exact. And there have been a few documented cases of children with autism spectrum disorder who also truly met the strict medical criteria for pandas. But pandas overall is fairly rare in any child or person, and it's fairly rare in autism. I don't think it's going to turn out to be a common cause of autistic-like symptoms. And what it is, it's a very abrupt onset, a dramatic change in the child, and not necessarily on a regular recurring cycle, but it's more intermittent, very episodic. But the child just acutely develops tics, which are neurologic movement disorders, and other kinds of severe movement problems, often associated with a severe obsessive compulsive disorder and very repetitive behaviors of high anxiety. And it's an abrupt change. It's not something that the child would show most of the time or on and off that they've shown for years. It's really dramatic and very different from how the child typically is. And these symptoms start when the child is sick with an infectious illness. And it can be more than strep. There's a broader term called pediatric acute onset neuropsychiatric syndrome, or PANS. And PANS is a broader term that includes pandas, because now we're finding other bugs besides strep can be associated with PANS. So if your child's well and not experiencing a fever and a beefy red sore throat with pus on at the back of the throat, and nausea and signs of acute infectious illness, there's no point in that moment of checking for pandas. And also, there's no one specific test for pandas. It's more this behavioral association of these very dramatic and unusually different neuropsychiatric symptoms of obsessive compulsions, high anxiety, and tics and movement disorders, only associated when the child has an infection. So generally, if your child is sick, has a sore throat, and their behavior is worsening, you take them to the doctor, swab, and see if there's a positive strep throat, and you need to treat the strep throat with antibiotics. And if the throat's not positive, but there's symptoms elsewhere like rash and soreness, especially in the private area. A lot of people don't know you can get strep bacteria growing in and around the anus or around the tip of the penis or around the vagina. So sometimes that's the source of the strep bacteria. And I've seen some beefy red rashes like around the anus, what we call perianal strep. But if you don't have the documented strep or very definite documentation of these behaviors only occurring when there's an infectious illness, it's not likely going to meet the clinical criteria for pandas, which has very strict clinical criteria and is actually fairly rare. Hope that helps.
That does help, but I want to follow that up with another question that somebody came to me recently and was describing because I want to be clear about this, and I know they had asked this question, that their child a couple of years ago, their child was very ill, and when they went through that illness afterwards, there was a rapid onset of a series of behaviors that involved much what you just described. They have not been diagnosed, because the child was older, they've not been diagnosed with autism, but they're looking at them for Tourette's because there's a series of tics and obsessive compulsive, and none of that had been around before that illness. Now, they didn't document strep with that illness, but they're now looking at treating him for Tourette's. And so my question was, had they had the child looked at for Pandas? Is it possible that it could be 3 years later and that they weren't looked for Pandas and that they're still experiencing these symptoms?
Well, it's possible, but it's more Tourette's itself is a genetic tic disorder, and it commonly starts showing up around age 6 to 9. And tics can show up under stress. So Tourette's is actually far more common than Pandas. And in Tourette's, the tics will wax and wane. You'll get more tics if the child's tired or gets an associated illness and whatnot. But there's still a kind of a chronicity. So if there's been a lot of tics and more times of tics than not tics, that's more likely true Tourette's syndrome and not necessarily Pandas. In Pandas, often when you treat the strep throat and make it go away, there'll be no tics or no symptoms for months, many months. And then it's only when they get another strep infection, then there's this abrupt change again. And so that's what looks different in Pandas than in Tourette's syndrome.
Okay. So does a strep throat start to go away on its own if you don't treat it?
It can, but it can lead to some neurological residuals. So if you know your child's prone to strep and has had strep throat in the past, especially when there's fever and headache and nausea associated with it, it's worth, and there's a rapid strep test doctors can readily do in their office to check for strep. Because we worry, there's a variety of what we can call post-streptococcal complications. So even though you're going to get over the strep throat on your own, you don't want to get any of those complications.
But a test would tell if that's what you were dealing with.
At the time of an acute illness. But if your child doesn't have a fever, doesn't have a sore throat, headache, and nausea, no sense in testing for strep when they feel perfectly well.
Okay. All right. But Dr. Copeland, we have a question right now about somebody wrote in and said, why does my child speak better right before he gets sick? And this is something that we've touched on a little bit before. So help us to understand. I know my son, when he spikes a fever, boy, the language is right there and it's very exciting. And then I go, oh no, he's getting sick.
Right. This is a Nobel Prize winning question. It's a real phenomenon. It's been documented scientifically over the last couple of decades, and it doesn't happen in all children with autism spectrum disorder, but it happens in a certain important percentage, and we don't know why, but it's definitely been documented to be true. And several things happen when you get sick. You may get fever. Fever increases the whole metabolic rate of the whole body, including the metabolic rate in the brain. So that may have something to do with why certain children with autism spectrum disorder actually talk more and use more language. They're maybe getting better brain connections because of the increased metabolic rate associated with the fever. And there's also speculation that it may have to do with a category of proteins our body produces called heat shock proteins. There's a lot of research interest in this from like Autism Speaks and the National Institute of Mental Health, trying to understand this phenomenon better because it may give us some important treatments. And in fact, one natural nutrient from broccoli, sulforaphane, was chosen for study to see if it benefited children with autism specifically because it works on heat shock proteins, stabilizes them, and it's also a powerful antioxidant. And we know kids with autism as a group tend to have more oxidative stress. And so that study of sulforaphane given over 18 weeks to boys ages 13 to 27 with moderate to severe autism showed some definite clinical improvement with sulforaphane. So there's going to be more research to come on why certain individuals with autism have this reaction to fever.
Yeah, and so I think there's something wonderful when, we had experienced this with Jem early on and saw, and I had said it to somebody and said, I feel like he can talk better when he has a fever, and I was told, oh, pshaw, that's not what's happening. And I think there's something wonderful when we find numbers, and as you said, there's scientific evidence to show that this phenomenon does happen. there's something comforting in that when we know, okay,
Yeah.
that's not my imagination, that's happening. And I think it gives us a whole lot of hope, because if that curtain can be lifted at the time of the fever, then absolutely there's got to be something else that will lift it as well. And we've seen that the broccoli is a great place to start.
Yes.
Wonderful. I want to ask you a question now about Tylenol, acetaminophen, and Motrin, and all those different painkillers. Somebody wrote in and said, I read an article that Tylenol makes it harder for our kiddos to rid their bodies of toxins. I don't like giving Motrin. It upsets my stomach, and my son already has stomach issues. What should I do if he has a fever?
Well, this is a complex question. Pediatricians are starting to recognize scientifically, medically, that low-grade fever when a child is fighting off an infection may actually be beneficial. So there may be no need to treat a low-grade infection other than to keep your child well hydrated, cool and comfortable, and watch them closely and make sure the fever doesn't get too high or last too long. You may not need to give any medicine at all. But so low-grade fever may be up to 101, 101.5, maybe even as high as 102 if they're comfortable. But if it gets any higher than that, we do worry about higher fever in children. Higher fever will make a child listless, sleepy, even a lethargic appearance. And you want to sort out what's a serious illness versus what's a viral illness they're going to get over on their own. So at that time, for a higher fever, and also to keep them well hydrated, you may want to get the fever down. And the safest medicines to use are either Tylenol or Motrin in kids. So you kind of have to make a decision about that. We don't know for sure that Tylenol is not well handled by all children with autism spectrum disorder, but there's theory that at least in a certain subgroup it may not be handled well, because Tylenol is acetaminophen, and it gets detoxified in the body through our sulfation system. Dr. Rosemary Waring showed in the 1990s that in her small studies, and it was only small groups of individuals with autism, had problems with their sulfation chemistry. And so theoretically then they could have trouble handling Tylenol. But if you're only giving Tylenol very rarely and only for higher fever, you're not too likely to overwhelm the child's natural detoxification system. And you can compensate by trying to help their sulfate metabolism with things like Epsom salt baths with magnesium sulfate.
Yeah, I keep meaning to get some more Epsom salt. What a wonderful, there are a couple of things in life that are so, they're multitaskers.
Right.
That you need to have in your household that are natural and that do a lot of good things. Epsom salt is one of those miracle things that you can put it in your bath. I understand that you can take it as a laxative. You can use it in your garden. It's one of those things we should always have on hand, right?
Yeah, and it's a good source for your body of both magnesium, which soothes muscles, and sulfate, which you need for your body detoxification.
On the show.
Yeah.
Now, Dr. Copeland, we had a question from someone saying, what do you recommend for a child who seems to have a never-ending supply of gas? And they also noted that it smells bad as well. I think a lot of our kiddos out there are gassy little so-and-sos. So what do you recommend?
Yeah, it's normal to produce some gas, but an excessive amount of smelly gas is concerning. And the first thing you look to is the diet. So I would recommend they check online. Stanford University in their GI department, they talk about a low FODMAPs diet. FODMAPs is an acronym, it's abbreviation for certain types of carbohydrates and artificial ingredients, sugar alcohols, that can, for some people, just wreak havoc on their GI tract and make them have a lot of gas and bloating and pain and alternating diarrhea and constipation. So lots and lots of gas. Think of FODMAPs first. And I actually have a list. You can go online and look at the foods that are low FODMAPs. The red are the high FODMAP foods, and the green here are alternatives. I don't have these memorized. I have to look it up every time, except I know onions. Onions give me excessive gas. So they're
Can I
high
ask you though, are you saying FOG as in FOG and MAP as in MAP?
FOD FOD is
Oh,
involved.
I thought you were
And
saying
it has a
FODMAP.
long fermentable oligodisaccharides
Okay.
and so forth. But it
Okay.
basically refers to some foods and artificial ingredients that give certain people who are FODMAP sensitive excessive gas. And it can include some otherwise healthy fruits and vegetables, but in excessive amount, people don't tolerate them, like a lot of beets or a lot of cabbage, a lot of cauliflower, onion. Those are pretty high FODMAP foods.
Okay. All the things that are
FODMAPs.
in season right now, as a matter of
Right,
fact.
right. And if you like a lot of those and you're eating them all together, you might be getting way too much in your diet. And then even certain fruits like apples and blackberries, cherries, pears, plums, and other healthy vegetables, snow peas. If you like high FODMAPs foods, you might not even realize that most of the foods you're taking are high FODMAPs. So you want to start substituting low FODMAP alternatives. Like instead of eating cauliflower, eat broccoli, because broccoli is low FODMAP. Most of the ingredients in salads are actually low FODMAPs, like lettuce and tomatoes and cucumber, fortunately, are low FODMAPs. And then you want to avoid the sugar alcohols, artificial ingredients, artificial dyes, and the sugar alcohols are in sugar-free gum, like xylitol, mannitol, sorbitol. If you're chewing a lot of sugar-free gum, you may be getting way too many of those sugar alcohols. So if you go online, you can see the complete list with some guidelines from University of Stanford of how to do a low FODMAPs diet for 2 to 8 weeks. And sometimes you'll get dramatic improvement in that smelly gas and the bloating that goes with it. And then you can introduce back as some of those nutritious foods, but just in smaller amounts. Like avocados, if you eat a quarter of an avocado, that's okay. If you eat a half an avocado, it may be a little bit too high in FODMAPs. So you can kind of slowly add back in so you're not missing too much of these good fruits and vegetables, and see how you tolerate it. But if the child doesn't improve, then you may want to ask the doctor to refer your child to a pediatric GI specialist, because there could be other issues like bacterial overgrowth or other unfriendly gut flora like yeast overgrowth and so forth. So you want to avoid excessive processed sugars and processed foods in general.
Okay, fabulous. And we've talked before on the show about yeast and yeast die-off, so that I just want to make sure that people know if you get rid of the sugar, if your child's been having a lot of sugar and you get rid of the sugar, things may get worse before they get better. I don't know if that's true of the gas as well.
Sometimes temporarily.
Okay.
But a lot more study needs to be done on this, but fortunately more and more GI specialists are getting interested in it.
Well, in fact, we had another question that came in this week. Somebody said, Dr. Copeland, why do so many of our kiddos seem to have intestinal issues, and how do we get our pediatricians to take it seriously?
Great question, and it goes back to what you were saying, that it's good for the parents who've long had years of concern. They are now being validated by medical science. So there's a meta-analysis of multiple GI studies that have been reviewed by national experts like Dr. Tim Bowie. He's a famous pediatric GI specialist from Harvard Medical School and the Lurie Center for Autism. The evidence is now showing that individuals with autism spectrum disorders have frequent GI problems. More than 50% of them have some sort of GI issues. Now, the GI issues don't seem to be unique to autism. They're the same kind of GI problems that other people can get, but use Dr. Bowie's article. He and his colleagues put out a major article in the journal Pediatrics, that's the journal of the American Academy of Pediatrics, in 2010, saying it's true, the science is there, kids with autism get more GI issues. It could be acid reflux, it could be bacterial overgrowth, trouble with what we call the gut microbiome. And it's helpful to try and get as friendly gut flora and gut bacteria as possible through the use of healthy probiotics and fermentable foods and so forth. So we've got to educate our pediatricians about it. The pediatric GI specialists are trying to get the pediatricians educated about it.
Good to know. So perhaps then the ideal thing is to ask for a referral to a pediatric gastroenterologist. Is that the thing to do?
We'll take that seriously.
And then, you know, what's good about that is that then if you can get the pediatrician to do that, then when you come back with information from the expert, I have a feeling that the regular pediatrician will find that something that they want to listen to. I think the tough thing sometimes with insurance is that you can ask your pediatrician for a gastroenterologist, and they may say no. What are some things that we could use in our arsenal to get the pediatrician to give us the referral?
Document the symptoms. You could journal it at home. Take that journal to your pediatrician. Make sure the pediatrician is documenting the symptoms. The days of diarrhea. It seems like individuals with autism spectrum disorder, they get the same kind of viral diarrhea that everybody else gets when it's going through a community, but theirs lasts longer. It takes longer for their GI tract to heal, and there may be genetic reasons for that. So the more you can document, you've got the medical evidence there that in that medical history that says a specialist is needed.
Okay, great. We're running out low on time, so I want to get to another question here. What should I do for my sensory sensitive child when he gets water in his ear at the pool?
One, if he's sensitive to water in his ear, you might see if you can desensitize him to wearing earplugs before he gets in the water. But that might be a sensory issue too, but you could practice a little bit, so that might help. And then the other thing is to teach him how to properly dry out his ears. If he likes the water, just how to dry out his ears. When he gets out of the water, you can tilt his head to the side and gently pat with a towel and just do the outer part of the ear, both sides. And you should never put anything down the ear canal, no Q-tips or anything like that. That can actually damage the ear canal. And then you do want to get the water out, because when the moisture sits there, it predisposes a person to getting a bacterial growth that will cause swimmer's ear. So there's a homemade mixture. As long as you know their eardrums aren't perforated, no holes in the eardrum from past ear infection or trauma. As long as their eardrums are intact, you can make your own mixture of 1 part white vinegar to 1 part rubbing alcohol. And then just take an eyedropper, and after he's patted his ears dry, you just drop a few drops in that, and the alcohol will cause an evaporating process that's mildly drying, and it'll dry out that extra moisture.
All right. Fabulous. I love that. Okay, and then our last question that we're going to have time for today. I think it may be time to put my son on meds for ADHD. He has such a hard time focusing. I really don't want to do risperidol because I don't want him to grow breasts. Are there other drugs?
I agree with your concern of wanting to avoid risperidol. Risperidol is not really specific for ADHD. Its indication in autism is for more severe problems, like really marked agitation and aggression. There is some time and place for risperidol, but it has many more side effects. Not all kids with autism grow breasts from the risperidol, but that is one of the serious side effects, and there are others too. So the individuals with autism tend to respond to the same ADHD medications that a child who just has ADHD but no autism spectrum will respond to. So one of the biggest families, well, they're called stimulant medications, and it's kind of ironic that stimulant medications help ADHD, but what they do is get consistent signals to the frontal lobes of the brain to concentrate and focus. So one big family is called the methylphenidates. That was one of the first families of medicines discovered many years ago to help ADHD, and that includes old-style Ritalin. Ritalin got bad press because it's been overused and the doses were too high at first, but actually it's a pretty safe medication for most individuals with ADHD. Any medicine can have side effects, so have your physician review all of that. But So that's one form, the methylphenidates. And there's newer versions of methylphenidates to last longer and have a more even release, so you don't get rebound symptoms when the medicine's wearing off. And surprisingly, another category of stimulants are types of amphetamines that are non-addictive. And these can also be effective for ADHD. But specifically in autism, the evidence goes with the methylphenidates. That's been research proven to be effective in the ADHD that kids with autism have often.
Wonderful. Great information for all of us to have. I know that it's a tough decision when parents are making that decision about whether to do meds or not, and we want the best information about the meds that we can.